The signing of Nigeria's HIV and AIDS Anti-Discrimination Act in 2014 was considered a giant stride in the national HIV response and has been translated into different languages and contexts, considering the peculiarities of the subsets of the population. Hello, I am Adesuwa Osuyi, and this is The Last Mile with NACA. The purpose of the Anti-Discrimination Act is to protect the rights and dignity of people living and affected by HIV and AIDS in Nigeria. The Act also applies to all employers of labor and employees, whether in the public or private sector. If you've not heard about the Anti-Discrimination Act, this episode is for you. Stay with us.
Stigma and discrimination are major drivers of HIV and AIDS. One of the main reasons people are reluctant to test for HIV, share their HIV status with others, or access the services and support, thereby increasing the spread and impact of HIV and AIDS. As part of the government's efforts to control the spread of the disease through legislation, the Anti-Discrimination Act was signed into law.
Nigeria joined the rest of the world to put system in place such that people would know more what HIV is, because also underneath stigma and discrimination is the fear of the unknown for most people. So we say fear for us in HIV work is false evidence appearing real. And they say it's a state without law, an environment without law. When there are no laws, there will not be offense. So Nigeria joined the global community to come up with laws to protect persons living with HIV. So we had the HIV Anti-Discrimination Act of 2014 to protect rights of people living with HIV. And the law is actually to talk about individuals' rights of those who are living with HIV, their responsibilities, then the responsibility of society at large, then there are institutional obligations that people must take caution of and know that all of this must be in place. And of course, he also spelled out penalties for those who have violated other people's rights according to the premise that have been set in the law.
Some examples of individual rights, that rights to employment benefits, rights to freedom from discrimination, right to access health, right to access comprehensive health services, right to be informed of your partner's HIV status, and right to bring civil action against persons that or organizations that discriminate against you. Some of the institutional responsibilities include confidentiality of information of your workers, duty to protect the rights of people living with HIV within your organization. It also includes compensation when wrongs are done, then to provision of HIV workplace policy. So some of the acts that amount to discrimination include denying access to employment or continued employment of people living with HIV and AIDS. Others include denying any person treatment or medication, refusal to admit into schools or worship places of people living with HIV, of people living with HIV, then denial of rights to be elected or appointed into political parties.
The National Agency for the Control of AIDS, NACA, with partners, have produced simplified versions of the Act in various languages and formats.
As soon as the law was enacted in 2014, we commenced working with our lawyers and all of our development partners to have it translated to level that people will understand. So we have it, the popular version, we have it in English, we have it in 3 Nigerian languages, Hausa, Yoruba, and Igbo, and Pidgin version. We also have it translated with religious quotations to support why we should not stigmatize or discriminate against people living with HIV. That our groups, NACA, supported that effort to have the biblical and Quranic quotation to match each of those provisions. We also had it translated into Braille form for those with sight impairment. We also ensure when we do all of this, we do not leave anyone behind. We have it translated. We have sign language available when we talk about it, so that even persons with disabilities are able to know their rights. So we have it in all of those forms. We have it on our platforms, on NACA websites, and on all available platforms for where you want to get resources for HIV. And if you need them, you contact us. We also give you.
You know, law is like a big technical jargon for a lot of people. If you are not versed in matters of law, it's difficult to understand what this law states. And we felt that majority of Nigerians who are being affected are people who don't understand the letters of the law. And it's important to, bring this law into their hands. They need to understand the law. They need to understand their own responsibility, their own obligation, the obligation of employers, the obligation of other people. So we partner with NACA, to come out with this simplified version, which we have the broken English version, we have the English version, and it's handy, as you can see. This contains all the law, basically, all the provisions. I can't say it's a record yet, because it hasn't had the desired impact. But I believe that with more work, with more effort by all partners, we'll get there. Because still, as I talk now, there are still instances of stigma and discrimination everywhere, against people who are HIV positive, which is sad, but we just need to keep the work going. We need to keep the awareness going. We need to ensure that the law works. The law is there, of course, but it needs to be made to work.
The agency also engages stakeholders at all levels to sensitize them on their roles with regards to provisions of the Act.
We have over 200 million Nigerians. We cannot go one-on-one. We have to partner with institutions, individuals, groups, mainstreaming HIV and issues around stigma and discrimination, and making them understand the role they can play in supporting the work for us to actually bring the epidemic to control, like we are doing. And in doing that, we engage with everybody. We engage with community members themselves, people living with HIV. There are other populations we call key population of the HIV program. We engage with them to understand what their roles will be, what their responsibility will be, what their rights will be. We also engage with different development partners, implementing partners, working on HIV, even if it's around support at the facility level, health workers, community workers, social workers, and also ministry departments and agencies, especially those whose work will impact on what we do, like the law enforcement institutions, the Nigerian police services, for them to understand that there is HIV Anti-Discrimination Act and to be able to properly apply it and use it within what they do, and also to make their services available. As we are not implementers, we coordinate all of this, and we also continue to build capacity of all stakeholders to engage with their own populations, to be able to know their rights and be able to access services.
Stigma and discrimination also threatens fundamental rights at work, undermining opportunities for people to obtain decent work and sustainable employment.
Around the issue of HIV, amongst the rights of individuals is confidentiality. You are not supposed to share somebody's HIV status, especially workplace, where people are tested wrongly without their consent, because science has already shown that HIV cannot be transmitted by you living, working or living with somebody living with HIV.
Organizations should not sack people based on their health status. There are some other health issues that are even more serious than HIV, and it's also not right for companies to deny anybody employment because of their HIV status. Because come to think of it, you don't deny people have hepatitis, and you don't sack people because they are diabetic. You don't sack people because they have high blood pressure. All they need to do is to manage the situation and make sure that every other person is safe with it, around them.
We need to ensure that organizations abide, imbibe, and have a workplace HIV policy. Because if you have a workplace policy, it automatically means you cannot discriminate against anyone based on their HIV status. Okay? Government is playing their part. The private sector must play their own part. It's critical. A lot of people are suffering because of the fear. Qualified Nigerians are unable to get the job they want because of their status. It is unfair. It is unfair. It is not right. And we must know that with HIV, it's about 40 years now in the world, we have young people, adolescents, who have known nothing except HIV/AIDS. And they're in thousands, they're in millions, all over the world. What are we saying to them? If we say they don't have a right to work, what are we telling them? They have no future.
Support NACA in the fight to attain HIV epidemic control by 2030. Call 6222 today.
We have a toll-free line, 6222. You call it, they don't charge you for it. When you call in, you speak to our agents and they direct you to the relevant division you need to meet to get help or support. Stigma and discrimination is one of the major barriers to the attainment of the HIV national response. And NACA is very committed in ensuring that stigma and discrimination is eliminated in all spheres of life. So we encourage people to call in. When you call in and you get justice, it will also encourage other people to also call in. So we encourage everybody, if your right has been trampled upon, we encourage you to call in.
Though the landmark legislation makes provisions for the prevention of HIV-related discrimination and provides for access to healthcare and other services, there are still challenges.
The size of the country is a challenge in the sense that we can't be everywhere at the same time. We have to have phased rollout. Like I said, it's only been domesticated in 18 states out of the 36 states and of course the FCT. And we also still need to continue to engage with everyone to ensure, number one, they have the law domesticated in their state. That's a lot of advocacy, a lot of high-level engagement, which is actually quite expensive. Beyond that, in terms of implementation, use of the law, a lot of times people don't, beyond the fact that they are not aware, for those who are aware, like I said, it takes a lot to want to muzzle the courage to go through litigation processes. Because
we know the legal environment in Nigeria, how it is so slow to get justice. That's a key challenge. Another challenge that we have been facing is for individuals to come up and report cases of stigma and discrimination. As I talk to you, there are religious organizations who still compels their congregation to run an HIV test before getting married. Okay? Without an HIV test, they won't join them in holy matrimony. These are challenges that we are facing. And these are totally not necessary.
So you see, we need, around our effort in stigma and discrimination, is actually more information about what HIV is and what is not, and the progress science has made in helping people living with the virus to live positive, and also the responsibility of the larger society to know that if we care for them well, they will come out, they will take care of themselves, they will take their medication, and as long as they are taking their medication, it will reduce transmission. They cannot transmit it to others. So
we must all say categorically, as a matter of urgency, that there is no room for discrimination, there is no room for stigmatization based on your HIV positive status. It isn't right. There shouldn't be that place for it in Nigeria.
The Anti-Discrimination Act of 2014, if adopted and properly implemented by all states of the Federation, is a veritable tool to help Nigeria achieve the global target of ending HIV by 2030.
What we want people to know is that there is an act against HIV stigma and discrimination. And the act has two components. There is the jail component, there is the fine component of it. So it can be both, actually, depending on the gravity. People with HIV live normal life. They work as productive as any member of the community. And among them are intelligent people, hardworking people. Why should we discriminate against them? If we stigmatize people and we discriminate, it puts them away from our hospitals. It prevents them from coming to our facility to know their status. It prevents them from coming to our facilities to take these medications that are very helpful. So stigma is a number one enemy for us in fighting HIV disease and in controlling HIV disease. And we will be all out against it.
This HIV self-test kit has been certified safe and effective by the WHO, Federal Ministry of Health and NACA. For more inquiries, call the NACA Information Center free of charge on 6222. Do not eat, drink or use mouth-cleaning products 30 minutes before the test. Find somewhere private with good light and a flat surface. The kit includes instruction leaflets that should be read carefully, a test stand and a sealed package containing a test device, developer tube and preservative used for storage only. This is not needed for the test. Open the test tube and place it in the test stand. Grab the test device by the handle. Do not touch the flat pad. Apply moderate pressure while swabbing the flat pad once along your upper gum and once along the lower gum. Immediately put the test device in the developer tube. Leave it there for 20 minutes before reading the result. Do not read the result after 40 minutes. Test is positive if both control and test lines appear, in which case you should contact NACA Information Center as soon as possible for advice on the next step. Test is negative if only control line appears. Test is invalid if there are no lines or only test line appear or the white result background becomes red and should be repeated. Properly dispose all contents in the normal trash. Support NACA and the fight against HIV. Know your HIV status today.
The Anti-Discrimination Act is a very important tool in the fight against HIV and AIDS if all actors involved both access and implement the provisions of the Act. The update segment is next. Keep watching.
Health Policy Plus, a project funded by the U.S. Agency for International Development, USAID, at its Exit of Project event, recently held in Abuja, presented an award to the Director General of the National Agency for the Control of AIDS, NACA, Dr. Gambo Aliyu. In his remarks, Dr. Aliyu commended Health Policy Plus for its activities in Nigeria since 2015.
I'm pleased to be part of this end of project event and wish to commend USAID supported Health Policy Plus project for the work it has done in Nigeria since 2015. The support for ownership and sustainability of the HIV response through this project at the national and subnational level is highly commendable. I wish to acknowledge and applaud Health Policy Plus for supporting NACA in the development of National Domestic Resource Mobilization and Sustainability Strategy for HIV 2021 to 2025. This strategy articulates key strategic and innovative approaches to address the current gap in domestic resourcing and financing of HIV prevention and treatment interventions in Nigeria. Implementation of this strategy can mobilize over $600 million for HIV control from domestic sources by 2025.
The NACA chieftain also acknowledged the project's impact on the Lagos State HIV response.
Health Policy Plus has strengthened the capacity of Lagos State Agency for the Control of AIDS and State AIDS and STI Control Agency to develop program-based budgets, submit evidence-based and compelling fund request memos to engage with the different multiple government agencies to facilitate the timely release of funds for HIV control in the state. This led to to improve budget performance in the state with a 32% increase in budget allocation for Lagos State on HIV from 2018 to 2021.
Highlight of the event was the presentation of awards. The Director, Performance Management and Resource Mobilization, NACA, Josephine Kalu, received the award on behalf of the Director General of the agency.
Sister! Where you dey rush dey go like this now? Take am easy now.
Na hospital I dey go to do HIV test.
Na everything you dey do HIV test. Before you carry belle, you do HIV test. Now you dey rush go do another HIV test. Wetin you dey find, you go see am o.
No be so, my sister. HIV test no be bad thing o. Na make I know my status so that no matter the result, my pikin no go get HIV.
HIV fit pass from mama to pikin.
Yes o, during pregnancy or labour or even when we dey breastfeed the pikin. Yes, and my husband dey road dey come sef, he go meet me for hospital. We go do the test together.
Hey, your husband na man he be. But wait o, una no dey fear. What if the result come out positive?
Fear wetin na? HIV no be death sen ten ce. And medicine don dey to take manage am. See, nowadays people wey get HIV, dey live their life normal like everybody else.
You sure say I no go follow you go do my own so?
Wetin you dey wait for now? Come make we go jare. With quick action, we fit stop this HIV waka from mama to pikin. Go do your own HIV test today.
UNICEF presents that globally, at least 300,000 children were newly infected with HIV in 2020. Now, of this alarming figure, Nigeria was responsible for 20,695 cases. This indicates a need for a much more strategic approach to prevent further decline in the nation's HIV infection rate.
About 300,000 children born HIV positive. Over 20,000 of them were born in Nigeria. This is a crisis of immense proportions, and it can potentially erode all the good work we've done over the last 2 decades.
The taps in the general population and key affected population are now running slowly. However, that of mother-to-child transmission is the one that is still running fast. And this means this year, 2022, we're going to look at expanding our services to include every pregnant woman and get them tested and make sure that every HIV positive pregnancy is prevented from transmitting that disease to the newborn.
The HIV Trust Fund is timely and will be critical in helping us address the gaps in acquiring test kits, laboratory reagents, and drugs for pregnant women over the next 5 years. We are excited about the private sector commitment to this cause and wish to thank them in advance for their engagement.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center, toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng. Thanks for watching, and as always, continue to support the HIV response. Do not stigmatize or discriminate people living with HIV. Avoid indiscriminate sex. And lastly, know your status and take action. Till next week on The Last Mile with NACA, I am Adesu Alsu.